Now, our lecture today is management of cystic lesion of the jaw. How we can manage cystic lesion of the jaw. In general, there are two methods mostly used for the management or treatment of cystic lesion of the jaws. These are either marsupialization or enucleation. Sometimes we can use actually marsupialization followed by enucleation. That means there is the marsupialization followed by second surgery, which is enucleation. Sometimes we can use enucleation with bone graft, which is very rare in case of cystic lesion of the jaws. Let us start with marsupialization procedure. Marsupialization, sometimes by definition, also can marsupialization or cystic decompression, or what we call by definition, it is decompression of the cystic lesion or release of the intracystic pressure, because there is fluid, so there is intracystic pressure. Release of the intracystic pressure by creating an opening, and this opening usually circular or ovoid, without removal of the cystic lining. That means the epithelial lining of the cystic lesion should be left, or should be left. That means without removal of the epithelial lining. This is actually the aim or the goal of this procedure is to decrease the cystic pressure and enhance osteogenesis of the jawbone, so that can reduce the size of the cystic lesion and subsequently healing of the cystic lesion. The most important thing here is to maintain the opening that we create to decrease the intracystic pressure. The indications of marsupialization or decompression: first of all, in case of large cystic lesion or cystic lesion close to vital structure, such as maxillary sinus, inferior alveolar neurovascular bundles, and so on. Also, in case of cystic lesion associated with unerupted teeth, such as dentigerous cyst, or also other cystic lesion, that means other cystic lesion of dentigerous cyst that is also associated with multiple teeth. This cystic lesion causing the drifting or displacement of the teeth. So in this case also can be treated by marsupialization in order to prevent trauma to neurovascular bundle of the teeth. Also, in case of young or old patient who is compromised or medically compromised and cannot undergo surgical treatment. So in this case, we can use also marsupialization, because actually marsupialization can be considered as not aggressive and conventional and conservative treatment for the cystic lesion of the jaw. The contraindications: actually, in case of small cystic lesion, we can use enucleation rather than marsupialization. The technique of marsupialization is, as we can see here, this is the cystic lesion in the mandible. Here, we try to create opening, ovoid or circular opening. This is by removal of the oral mucosa, followed by removal of the underlying bone and the creating of the wound. Here, the opening is created, and then the lining, I mean the cystic lining, sutured to the oral mucosa, surrounding oral mucosa. This is actually to convert the pouch of the cystic lesion within the oral cavity, or to make the pouch of the cystic lesion continue within the oral cavity. After creating this opening, the opening should be maintained. That means the opening should stay open, should be maintained. And this is by insertion a plug. This plug, either we can use ribbon gauze impregnated with whitehead varnish, which is antiseptic material, or you can use actually plug that is fabricated plug made of or made from resin, acrylic resin, or methyl methacrylate, or sometimes you can use stent as well. So this depends on the age of the patient, number of the present teeth, missing teeth, and the type of the cystic lesion. Actually, it is more preferable to use obturator made of resin or methyl methacrylate. It is better than the use of ribbon gauze impregnated with antiseptic or whitehead varnish, because the gauze usually actually does not prevent the entering of the food or fluid, and also does not prevent the bacteria, and also it needs frequent removal or frequent changing of the gauze, because the gauze should be changed every 2 days. So in this case, obturator made of resin, acrylic resin, or methyl methacrylate, it is more preferable change the gauze and also to prevent entering of the food and so on. Now, the disadvantages of marsupialization, it needs regular follow-up. Actually, this is in order to check the size of the cystic lesion. Patient care, patient should clean the opening and also clean the area. That means it needs oral hygiene. Plug should be adjusted. As I mentioned before, the plug or the obturator or even the gauze should be changed every 2 days, and the plug should be reduced because the cystic lesion, the purpose of the marsupialization is to decrease the cystic size, and subsequently the opening also should be, or the plug of the opening should be adjusted because there is reduction in the size of the opening. The possibility of recurrence, this is due to the lining, because in this procedure we left the lining, so in this case the possibility of recurrence very high because of the lining still remain within the cystic cavity. Bothering for the patient because it is since there is opening in the oral cavity, so this may cause bother for the patient. Alternative procedure is enucleation, or what we call cystectomy. In case of enucleation, that means cystectomy, removal of the entire cystic lesion. That means the lining should be removed without bone removal. So here, the lining should be removed. In case of marsupialization, the lining should be remain within the cystic cavity. The indication, usually actually enucleation, indicated in case of small cystic lesion or cystic lesion less than 5 centimeters in size. The technique of enucleation, here we can see this, the cystic lesion in the maxilla. So we can use either two-sided or three-sided flap, just like in case of endodontic surgery. So three-sided flap we can use. After raising the flap, the bone should be removed. So here, the bone should be removed in order to get access. That means to get accessibility and visibility to the cystic cavity. So the purpose of bone removal to obtain or to get access and visibility to the cystic cavity. Here, removal of the bone by surgical handpiece. After removal of the surgical handpiece, we can use excavator to curate the cystic cavity and to remove the entire cyst. That means the lining and the connective tissue capsule should be removed. Sometimes, actually, in order to remove or to make sure that there is no remnant of the lining or no remnant of the cells, epithelial cells, we can remove inexact or immeasurable amount of bone, so that to make the bone, the bone of the cyst should be smooth in order to enhance or to make sure that there is no remnant of epithelial lining or even the remnant of cells. Then after, as we can see here, there is removal of the entire cystic lesion. Then after irrigation and then reapproximation and suturing of the area. Actually, the healing here after enucleation should be primary intention, by primary intention. Usually after enucleation, because there is a flap and reapproximation, so the healing should be by primary intention. Concerning the teeth, sometimes the teeth in the area of the cyst, either if the teeth is broken or badly carious, in this case, extraction of the teeth, or we can use extractive procedure, that means endodontic surgery, and we can treat this teeth either by orthograde filling or orthograde filling followed by retrograde filling. The disadvantages of enucleation: if the large cystic lesion, this may cause weakening of the jaw, or sometimes pathological fracture if subjected to any physical trauma. In case of large cystic lesion, also, it is more preferable to use marsupialization. The enucleation may traumatize adjacent teeth, because if the cystic lesion is large enough and involve the root of adjacent teeth, this may cause trauma to the adjacent teeth. Sometimes it may require bone graft or bone substitute. Actually, this is not true or not usually used in case of the cystic lesion of the jaw, because the healing potential of the jaw is very high. So we don't need bone graft or even bone substitute. The disadvantage also, it cannot be used in case of old age or medically compromised patient, because it cannot withstand the surgical operation. So in this case, because it needs more time. The other techniques that can be used for treatment of the cystic lesion is marsupialization, which is conservative.